We're here now with Dr. Howard Ruscetti. And Doctor, thank you so much for being here.
Welcome.
I understand that you do have a role here, of course, at Wilmington Health, but that you also reach out internationally. So tell us a little bit about all of that.
Sure, Grace. My role here in Wilmington Health is, my office is down in Carolina Beach. I'm a family physician, and I have been fortunate enough to meet a number of physicians in the community and community organizations that are very active in international mission work. And I've been able to go to Africa a number of times, to sub-Saharan Africa. I've been to Zimbabwe a number of times, in Kenya, evaluating AIDS orphans. We spend time there deworming children and evaluating the tropical illnesses that they may have. It's short-term work, but it's fulfilling, and it's work that I think it's easy to not pay attention to in our society. Most recently, we've been to Haiti, where after the disaster happened, there's a number of homeless people there, and folks that have medical and spiritual as well as physical needs. And so we went there a couple times this year and evaluated children there and adults there, some with injuries after the earthquake, and most of them just with psychological problems that they've been dealing with since the loss of their children or family members and their houses, and there's been a great deal of suffering, and they're truly our neighbors, and seeing that just right at our back doors is very difficult. And I think we have an obligation as humans to do everything we can to help them.
Wow, there's so much more than what we see on television. I'm sure you see a much bigger scope of the disaster and how it affects people.
Yeah, I mean, you know, we hear about the numbers here, and we hear about the lives lost, and we hear about the number of people that are homeless. But when you sit down and you talk to a 15-year-old child who is afraid to get out of his tent because he doesn't want to be in a house that may collapse on him, or he doesn't want to spend time doing the things that he used to enjoy doing, like playing soccer, because he lost his father who used to go to his games and he used to play with. That really puts a face on the disaster, and it makes you realize how fortunate we are.
Well, I'm sure that makes you a much better physician for us here. Thank you so much for all of your good work.
Welcome.